Pregnancy losses. That is something which disturbs all of us. Nobody wants to have a miscarriage, and it upsets the couple, the family, and the doctors too. But sometimes this pregnancy losses can cause severe damage to somebody's health and life and fertility. I think all of you have heard something called ectopic pregnancy, where the pregnancy does not sit in the normal uterine cavity where it is supposed to stay, which is inside the womb. Instead of that, it either settles on the fallopian tube or around the ovary and cause severe damage to health. Now, how to find out whether I am having a problem like this or not? First thing, whenever you are planning pregnancy, it is always advisable to come for a pre-pregnancy checkup. The reason behind that is we can detect a lot of maternal diseases, abnormal conditions of uterus and do a health screening, and some of these reasons can be treated beforehand. Now, pregnancy is not always a planned thing, so as soon as you think you can be pregnant, you miss a period, on 4th, 5th day onwards, you can do a simple home pregnancy test. And our advice is, whenever you see a pregnancy test card or test from the lab which is positive, please inform us. Our duty is to find out whether the lady is healthy and whether the pregnancy is healthy, and most important, whether the pregnancy is growing in the right place. Now, what happens? Going back to the physiological knowledge, one egg is released from the ovary, which is taken up by the fallopian tube, and the fertilization, means the combination of egg and sperm to make a baby, happens in the fallopian tube, not in the uterus. So from the point of meeting, that means fertilization, it takes 4 to 5 days for the embryo to travel through the tube and come and settle in the uterus. So if there is a tubal pathology, infection, abnormal course of the tube, caliber, any partial block, then the pregnancy tends to stop in the tube and start growing there. And tube being a very thin tubular structure, it can only hold the pregnancy for maybe a few days to only a couple of weeks. So anybody who is pregnant, seeing any sort of pain, feeling any sort of pain, and seeing any drop of abnormal bleeding or abnormal vaginal discharge, please contact your gynecologist. Now, what happens? Ectopic pregnancy usually presents with pain, but sometimes the pain happens when the patient collapses. Once the fallopian tube bursts, there is severe bleeding inside the abdominal cavity, and occasionally patient goes in a blackout, drops down, and we see these patients coming into intensive care immediately. The promptness of mind and action is something which saves the patients with ectopic pregnancy. Now, the good thing is that with ultrasound getting available everywhere, we can now detect most of our ectopic pregnancies before they could damage your tube or your health. So, once your pregnancy test become positive, after consulting with your doctor, get a ultrasonography done to see whether it is coming up in the right place. Now, if we detect unruptured ectopic pregnancy, there are some medical managements available, but unfortunately, if the tube is ruptured or a major portion of the tube is damaged, then removal or opening up the tube is necessary. But again, if you have an ectopic and if you lose a tube, don't get depressed, don't think it's the end of fertility, because the other side is always there for next pregnancy. So people who have one tube operated, they shouldn't be scared of future fertility. because it's quite common to have a normal pregnancy next time. Only 15% of pregnancies come next time as ectopic pregnancy. So looking from the other side, 85% of ladies with one ectopic pregnancy should be able to conceive normally and have a normal healthy pregnancy. Wish you all luck.